Swadikap, good afternoon once again. Today is Tuesday, the 1st of June, 2021. We're commencing a few minutes earlier today than usual. So today, so far, Thailand now ranks at number 82 around the world compared to other countries around the world, with some of the countries like India being on top of the list in terms of the COVID infection, in terms of the global tally. Previously, last month perhaps, we were around 115, and then we went up the rank actually to reach number 82, hoping that we will not go that high with the cooperation from all sectors of society and all groups and every one of you here. I'd like to start off with the number of cases that we recorded for today. 2,230 is the number recorded for today, the 1st of June. Out of this number, 1,326 are from local transmission, 806 are from active case finding, 77 from within the penitentiaries, and 21 traveling from abroad and in the state quarantine system. You might note that the active case finding number is quite high, which is very good, because those who are found positive are placed directly into the quarantine and treatment system. That's 806 cases from active case finding today. We have total recoveries is quite high, recorded for today at 3,390, and this surpasses the number of cases we have additional for today. Active cases still being treated, is 49,218, as you see on screen in the green box on top. And out of this number, there are 1,236 cases out of the 49,000 having pneumonitis or lung inflammation. And there are 378 cases of these active cases that are on ventilators, 378 on ventilators. New fatalities, we have 38, which makes the cumulative number now 1,069. 38 new fatalities is composed of 19 male and 19 female, half-half. And the age range is 46 to 88, with the median age being at 63. Most of the fatalities, numbering exactly 22, are from Bangkok. Now, in terms of the provinces, the provincial distribution of the new confirmed case, you have that on screen for you. Bangkok, Samut Prakan, Phetchaburi. As we mentioned a few days ago, Phetchaburi was a province that was high on the list after Bangkok. And it's a province that's not actually in the vicinity of Bangkok. So this changes on a daily basis. You have Bangkok at 864 today in terms of new cases, followed by Samut Prakan at 253, Phetchaburi at 166, Trang province at 164, and Nonthaburi province in the vicinity of Bangkok at 112. From the daily CCSA meeting that we had this morning, most of the new confirmed cases are still related to the high-risk areas such as factories, construction sites, penitentiaries, and transmission rates in communities are now found to be a little bit lower than the past few days. New cases found from communities in Bangkok are also lower, especially in Klong Tei district. If you recall, a few weeks ago, we talked about the Klong Tei cluster. Now, it's good news that the new cases from such communities, such as Klong Tei in Bangkok, are getting a little bit lower right now. The situation is gradually improving district-wise. Now, however, the new clusters are still found in factories in some outer provinces. If you recall, the number of provinces that had no new infections in the past day numbered up to 30 provinces, almost half of the number of provinces in Thailand. But there are here and there new clusters springing out in the provinces as well. One such is in Trang province, as well as in Phetchaburi, Samut Prakan, and Saraburi provinces. These are small new clusters found in factories in these provinces to date. So therefore, the Ministry of Public Health is now revising the mutual guideline for community quarantine and community isolation and the bubble and seal measures that they have been implementing and using to communicate with various entities across the country, including in the provinces. So this guideline, which will be revised to be more rigid, this guideline will provide the directions for the Provincial Public Health Office to operate in areas with high infection rates. And the aim of these measures is to separate high-risk contacts and infected persons in the safest and fastest way possible. So as you can see, we are adjusting on a daily basis according to the situation. Now, some new clusters in the provinces, so the Health Ministry is accordingly adjusting the guidelines for the provincial officials to use in dealing with these small new clusters that are sprouting up in the past day or two. Now, according to the news from yesterday, as you may have seen regarding the relaxation of control measures in the Bangkok metropolitan area, and the CCSA has decided that the current disease control measures that are imposed in Bangkok will be prolonged for 14 more days until the 14th of June. The decision is based on the high number of infection rates in Bangkok that remains. The Prime Minister, as the chair of the CCSA, directed that employees of businesses that are currently closed under the restrictions should be prioritized in the BMA inoculation plan as well, in order to allow them to resume operations as soon as possible, for example, from the 14th of June onwards. Dr. Teasing just now also talked about the border controls that we have been looking into very strict implementation and enforcement, border controls with our neighboring countries. And following the current situation and lockdown measures in Malaysia, for example, the government has ordered the security officials to tighten patrol along the southern border to make sure people are not entering Thailand illegally. As you recall, the number of people entering Thailand through natural pathways, which is, as you see on screen, through mountains, rivers, streams, and the like, include those who are Thai nationals as well as non-Thai nationals who enter the country illegally with the hope of not having to be quarantined. So this is being strictly enforced, as you see. On another side, the governor of Sa Kaeo province also reported to the CCSA that the number of Thai nationals who cross the border illegally from Cambodia is also increasing. So the picture you had now was on the southern border with Malaysia. Now, in terms of Cambodia, the number is unfortunately increasing, especially for Thai nationals returning to Thailand through illegal means. The government would like to encourage everyone to cooperate with officials and enter the country through legal means, follow measures strictly, and to help prevent the spread of the virus. Of course, in terms of the enforcement, and there are the legal aspects of it, the penalties involved. Now, one important piece of information is about the naming of variants. As you recall, the other day I talked about being politically correct and not talking about variants in terms of the country, a country XX variant, but rather variant first detected in XXX country, for example. Now, yesterday, the World Health Organization assigned a simple and easy to say and remember labels that are easy to use for the key variants of the virus that causes COVID-19 by using letters in the Greek alphabet. So while the existing scientific names such as B.1.1.7, B117, while this scientific name will continue to be used in terms of research, and in the research scientific community, they can be difficult to recall and are prone to misreporting by the press. And as a result, people resort to calling variants by the places which they were first detected. So as I mentioned, country XX variant, which is actually stigmatizing and discriminatory. So to avoid this and simplify public communication, the World Health Organization has encouraged national authorities around the world, media outlets, and other entities, the public as well, to adopt these new labels. So you see on screen right now, the 4 variants of concern will now be called as follows. Alpha for the B117 variant first detected in the UK. Beta for B1351 for the variant first detected in South Africa. Gamma for P1 variant first detected in Brazil, and Delta for B16172 first detected in India. So before closing, I'd just like to give you an update on our homegrown vaccine developed in Thailand. You may have seen that in the news. Developed by Chulalongkorn University, which is the Covid-19 vaccine. Actually, we talked about this a few months ago. This is a vaccine which is the first mRNA vaccine being produced locally and has shown promising results in preclinical studies in animals and mouse and primate models. It will enter the first phase of human trial this month in June and could enter mass production within next year. This is part of the plan to provide more supply of domestic vaccine security for the country. So this is the update I have for you today. Have a happy rest of the day here on Tuesday, the first day of June 2021. Best wishes, stay strong. สวัสดีครับ
ครับขอบพระคุณนะครับ